you were asking earlier. So if you want me to, I can read those out. I hope that covers the points that you've raised.
Yes, except that means the final reporting actually, because part of the funds will be spent in UK, yes. I believe, yes, and part of the funds would be utilized in Nairobi, Kenya. So for one thing first, that would the funds be divided and directed direct to UK as well as to London, Nairobi?
No, the rules of Rotary Foundation grants are that all income has to go into the one account, which will be the account in Nairobi. Even though some of the funds are coming from the UK, they have to go in there so that the Rotary Foundation can see that the project doesn't start until all funds are in the account. It's very important because they don't want to see a situation where perhaps some of the funding comes in and the rest doesn't, and then the project can fail. So it needs to be that all the funds are paid into, and then into the account. And then, of course, some will then be remitted back to World Medical Education in the UK. As for report writing, the way I foresee this working, because it is a complicated project, is that we will have to do a coordinating exercise, Josephine and I, to get the reports from World Medical Education and also from the College of Health Sciences. I don't know where that buzzing is coming from. And also, of course, from the Rotary Club. So there are several different strands of the report, and that'll be a headache that Josephine and I will have to deal with in due course as fellow Rotarians, or I might be working with you directly, Sudesh. I don't know how that'll work out. Between us, we will write a very good report, I'm sure.
It clarifies everything. I know that is going to be a bit of a headache. That's why I wanted more clarity on this.
It's certainly going to be a lot of work. The work hasn't started yet, although we've been at it for 6 months, have we now, Josephine?
Yes, in about 6 months. And now that you've asked, if you don't mind, I just want to bring to the conversation Dr. Beatrice Kiptanui. Beatrice is a member of our Rotary Club, the Rotary Club of Nairobi. She's a dentist, and she has practiced professionally in the United Kingdom for several years following her training there. She returned to Kenya about a year ago. And currently, Beatrice is the country focal point on COVID-19 for Rotary Country Office. She's asked a question around PPEs, but I just wonder if she wants to make a comment before I'm sure Chris will answer your question on PPEs and dentists. Dr. Kipton, do you have anything you wanted to contribute?
Well, first of all, I'd like to say thank you very much for a really informative presentation. The punch points were significant and really what a lot of people are keen on. I think that we have learned so much, being as it may, that the pandemic has been a new experience for everyone. But one of the mercies that has been accorded to us is that the measures that we can take are somewhat simple, and the simplicity of them might catch us unawares because it is the basic principle of avoiding cross-infection. My experience here at home and in comparison to the 20 years or so that I spent in the UK is that the approach and the difference in them can be our biggest blessing too, in that the outcomes are speaking to the differences in the cultural practices, both as professionals and socially. The reasoning behind my question is that in having the privilege of participation in the forum of medical practitioners as well as dental practitioners, I see that certain collaborations would really take us a long way forward. And so my interest is that PPEs and the whole issue of aerosol generating procedures, as well as close contact with patients, is something that comes naturally to the dental world. And so when a lot of people were fretting about what happens with an airborne condition, the dentist said, well, we've been doing this for a long time. We could actually help if someone would ask us. And so we set about in the dental world creating our own protocols. And I fear there might have been a little bit of duplication, but with something as brilliant as the World Medical Education that you have illustrated today, visual, tell, show, and do is a fantastic way to get that message across at affordable rates around the planet, especially now that many people are using phones on a regular basis. So it is of interest to me whether that collaboration is seen as an asset both at the primary and the secondary level and even the tertiary level. And what, Professor Callahan, what your experience of that collaboration has been, because I think it's worth implementing if it hasn't already happened.
Chris, do you want to?
Yeah, I mean, that's a very thoughtful. Yeah. Can you hear me? Yes.
Yes.
Hello. Yes, that's a very thoughtful summary. Can you hear me all right, John?
I can hear you okay.
Fantastic. And very insightful. So I've been discussing this with a dentist that we're doing a project on oral cancer with. And it's obvious to me that the dental work you do in terms of drilling and the generation of fluids has the potential to aerosolize a lot of virus. It's interesting that the virus seems to stick very well to the respiratory epithelium, and it's when it's generated in some way, like a cough or some of the procedures that you do, could really release a lot of virus. And I'd be very interested to chat to you further about that and to see what we could do, because I think protection of dental, so dentists and the staff that work with you, again, is another hugely crucial thing. We were talking about trying to get our laser systems into dental practices and look at the aerosol being generated. And we've just got funding to, one of my other areas of interest is in aerosol spread of pathogens and drugs and things. So I think there's options for looking at it a little bit more critically. But in the meantime, I think if you've got systems that are being adopted nationally, having videos that can actually demonstrate that, and then give it, I think if you tell somebody to do something, sometimes they don't always do it, but if you explain to them why as well, that can really help. So they get an understanding. And I think, tragically in the UK, I think the message hasn't always got across because we're told to do things, but it's the actual process isn't always, explained. And I'd love to chat further with you. So Josephine's got my details, and I'd be very happy to have an offline conversation.
Brilliant. I look forward to that.
That's
Thank
great.
you.
Nice to meet you.
That sounds like an excellent connection to make. Thank you.
Thank you.
Thank you very much indeed. Do we have any further questions?
I see Rotarian Roberta Mello on the call, President Ritesh.
Yes.
I'm sure she has something to contribute. I'm very sure.
Welcome, 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 AG Roberta from Brazil.
You're muted at the moment.
Unmute yourself. Yes.
Sorry. Good morning here in Brazil. It's in the morning. It's my pleasure to be here with you all. Thank you. And let's going on the meeting. Thank you.
Thank you so much, and thank you for your support. You're a frequent visitor at our club meetings, and we are very grateful. Thank you.
Thank you.
Okay. I don't think there is any other question from anyone. Yes.
I think you'll want to wrap up in a moment, but if anybody thinks of any questions, either who's here at the moment or has already left the meeting, please just, probably the easiest way is to route them through Ambassador Josephine, because we'd be delighted to answer any questions that you have. This is a very important project. Your club will be very much involved in the whole project, and we need everyone to be absolutely certain they understand their roles and how it'll work. It's a very exciting project, but it's going to keep a lot of us very busy for a very long time. So please do get in touch.
Thank you very much indeed, PDG John James and Professor Chris O'Callaghan for staying on, as well as Professor Machoki. Thank you so much all for staying on, and we are very grateful. In closing, I'd like Past President Sudesh and Ambassador Josephine to say something to us, and we're good to close the meeting.
Josephine?
I want to thank all of us for the time spent this afternoon to elucidate the technical and quality work that this team has put into developing this project. I also want to thank my club, the Rotary Club of Nairobi, for playing host to this project. Without your support, friendship, and fellowship, it would not have been possible to bring the jewel of this project home to Kenya. We look forward to continuing to work together. Over to you, Sudesh.
Thanks. That is all I can say. It is a beautiful project and very well presented. We were able to get deep insight into the project. Chris, your presentation was really very informative. And John, you clarified so many things, demystified the project. So I think our members would be more interested in it from now onwards. And we'll work together. And thanks again, thanks a lot. And of course, thanks to Josephine, who is spearheading it from our side, and she had been working incessantly for a long time. Thank you, Josephine.
Thank you, Sudesh, and thank you, President Ritesh. Thank you.
Ambassador Josephine. Thank you so much. And I've noticed, I've actually forgotten to say, Dr. Emily, please say something to us.
Yay. Thank you very much. It has been a pleasure to work with the team for the last few months, and I look forward, as Ambassador Ojambo has said, to contributing as a member of the diaspora to combating COVID, and also providing medical education in collaboration with the Rotary and World Medical Education. So as diaspora, we always think, how can we support our home countries? And this has been a wonderful opportunity. So I'm very grateful, and I thank all the team members and the Rotary Club. Thank you.
Could I say a word, please?
Yes, please.
I'm forced to do this because I've known Emily since she was year high, and I want to just commend her. She's a really hardworking doctor, and has been very generous with her time, her skills, and her effort. I have known her as a Bible study student as well, and I just want to say we are very proud of what you're doing and what is trickling back to us back at home. And it's wonderful, having been on both sides of the divide, to see the collaborative effort. So thank you very much, Emily, and we commend you on your efforts.
Thank you, Beatrice. Thank you.
Thank you. Thank you all so much. Dr. Beatrice, final announcement?
Yes, indeed. I have the privilege of being part of the a committee that is the vocational committee. And I want to just reinforce a message that was put across by our president regarding our event on Friday. That's tomorrow evening. That is from Success Significance, a fireside chat. This is a wonderful opportunity for us to draw on the amazing wealth of success and experience that we have within our club, outside of Rotary activities, but also to link that to how that impacts us. We have a plethora of worthy speakers, including Dr. Manu Chandaria, Mike Eldon, past presidents, Evelyn, Aaron, and Sally. And we look forward to having as many of you present, because I'm sure your presence will also enrich the conversation. So we look forward to seeing you tomorrow. That's Friday, the 2nd of October at 6:30 to 7:30 p.m. And I'm sure that the information will be available on our different fora. We look forward to that. Thank you.
Thank you. Thank you so much. And the meeting is officially closed.
Thank you.
Thank you. Thank you very much, Ritesh. Thank you, John.
Thank you, Ritesh.
Thank you, Josephine.
Thank you,
Chris.
Josephine and Sudesh.
Yeah, thank you, Chris.
Bye-bye.
Thank you, Billy. Thank you, Prof. Machoki.
Thank you, Josephine and President Ritesh. Wonderful. Thank you. And to Sudesh as well. Wonderful. Thank you.
Thanks, Chris. Thanks to
Thank
you.
you. Thank you.
The main
Josephine.
speaker.
Yeah.
Indeed. Thank you.